This is Gerald Weston bringing the Living Church of God report for April the 6th, 2020. I received an email this morning from one of our ministers who has a contact in New York City, and he wrote the following. The situation described in New York is grim. And then speaking of this person he knows there, he says her boss lost her mother-in-law and they are temporarily burying people in the parks because the morgues are full. Maybe this is a wake-up call that some will listen to. We had a wonderful meeting this morning to discuss how do we get that message out? How can we help people that are listening to understand the most important things that they need to understand at this time? We really discussed two things. One was the focus of our message. How do we focus that message at this time in history? And secondarily, how do we take that focus message and get it to the world? Because there's so much out there, how do we cut through all the clutter? And we came up with some ideas, and I'll just say this at this point. We're not going to wait around for months to begin to do certain things. We recognize that now is the time. The iron is hot. We need to strike while it's hot. We need to get the message out. And so you'll see some things that are happening very, very quickly from the work. I also received an email from one of our ministers down in Florida, and he was quoting here an individual by the name of Jonathan Smith, who is an epidemiologist at Yale. And I did look this up, and he is very mainstream. He's in newspapers, and so this is very legitimate. And he had 2 points. He says, first, we are in the very infancy of this epidemic's trajectory. That means even with these measures of social distancing, which he is promoting, we will see cases and deaths continue to rise globally, nationally, and in our communities in the coming weeks. Our hospitals will be overwhelmed. And that reminds me of Dr. Roderick C. Meredith mentioning that disease epidemics would come when we would not have the medical facilities to be able to handle all of the cases. And we've already seen that in Italy and Spain and elsewhere where the medical facilities are simply overwhelmed, and we're very close to that in some of our larger cities, especially New York City. This may lead some people to think that social distancing measures are not working. They are. They may feel futile. They aren't. You will feel discouraged. You should. This is normal in chaos, but this is also a normal epidemic trajectory. Stay calm. And then the second point that he brings out is that study after study demonstrates that even if there is only a little bit of connection between groups, social dinners, play dates, playgrounds, etc., the epidemic trajectory isn't much different than if we took no measures at all. He says you should perceive your entire family to function as a single individual unit. If one person puts themselves at risk, everyone in the unit is at risk. Seemingly small social chains get large and complex with alarming speed. If your son visits his girlfriend and you later sneak over for coffee with a neighbor, your neighbor is now connected to the infected office worker that your son's girlfriend's mother shook hands with. This sounds silly. It's not. This is not a joke or a hypothetical. We as epidemiologists see it borne out in the data time and time again, and no one listens. Conversely, any break in that chain breaks disease transmission along that chain. A little later he says, it's hard, even for me, to conceptualize how one quick little get-together can undermine the entire framework of a public health intervention, but it does. I promise you it does. And then he says, I promise 3 times. You can't cheat it. People are already itching to cheat on the social distancing precautions just a little. A play date, a haircut, or picking up a needless item at the store, etc. From a transmission dynamic standpoint, this very quickly recreates a highly connected social network that undermines all of the work the community has done so far. So I urge all of you to take these things seriously. Don't wait till there's a problem close by. Practice social distancing in a very strict way as much as you can and see your family in the household as a single unit that does need to be protected. I also received an email from another minister who wrote the following. This is from Wyatt Siselka in eastern North Carolina. He says, the brethren are talking more and getting to know each other better over the last few weeks. There are a few people who used to only circulate in their small group of one or two friends, and now they are interacting with their entire local congregation. Of course, he's talking about interacting by means of electronics, WebEx or Skype or some means along that line. So he can still interact. It's not the best way, but it certainly can break down barriers that maybe were there before. And I hope that all of you will look out for one another and communicate with one another and show love toward one another. So this is Gerald Weston for Living Church of God Report, April the 6th, 2020. Have a wonderful day.